All right, so thank you everyone. We are here again. Today is the 20th of January 2024, and it's a very great year, and we're starting off in a very good footing. We have one of our own. He's a Nigerian-born but American-based doctor, no other person than Dr. Obieze. Dr. Obieze has been in the US for quite some time now. He's a cardiothoracic surgeon and also a fellow in that area. He's been doing great, like he's been doing exploits in the area of a doctor's migration and trying to simplify the process, trying to help doctors to know what to do about, coming over here. And also he has a lot of a wealth, a very big, vast knowledge about how doctors can migrate here, not just only migrating here, how you can also stay, you know, do positive things when you come here. Like, I know we've been talking a lot recently, and he shared with me one of the very brilliant programs that he organized, like for foreign medical graduates when they come here and they haven't picked a job yet. He has a very good resource and a training program that he can do for those people so that you can be able to at least start earning decent amount of money before you can, be matched for residency and all that. So there's a lot that this program is going to, afford all of us. Today is not going to be enough for us to take all that he has to offer. So we're just going to take it little by little. I told him we're booking him for 4 sessions. So today is just going to be one session. Then we'll have another session and then yet another. But that all that will be based on his availability because he is a very busy person. All right, so you're all welcome to today's program. So Dr. Obieze, I don't know if you can hear me, but I'm just going to spotlight you for everyone. I don't know if your partner is here already. Is he here right now? Can you unmute yourself? I'm giving you that privilege to unmute yourself. Try it now. Good.
Good morning, everyone, or good evening, I should say. It's a pleasure to be here. Thank you for the opportunity. My partner's still trying to get in. I don't see his Tower Square here yet. I'll send him a message to also try again. But whenever you're ready, I think we're good to move forward.
Yeah, I just want us to get to know the people that we have here. The population of the people we have here, they are all medical doctors. They are the ones we invited here today, either medical doctors or friends of medical doctors who want to get the information across to a medical doctor or a physician that want to, relocate, come to the US. So I don't know. I would like you to, first of all, I know you have a lot on your chest that you would like to, pour out. So I would like you to, first of all, give us a little bit of intro about what you do, who you are. I was trying to do an introduction, but I know I can't do it so perfectly as you may want it. So please, is it possible for you to give us a little bit of background about yourself, please?
Sure, I will. And if I can share my screen, it might actually be easier to do it that way as well.
Okay, I agree.
Um, while he's working on that, I'd encourage as many of you as feel comfortable in a good enough environment, to share your screen so at least I can see some faces. You'd be surprised how often we run into one another, either at an airport or at some meeting or somewhere. So at least I can place some faces to the names that I see here. It would be really helpful.
So he's just requesting that if you can use your camera, just turn your camera on if you're in a very good environment where he can see your faces. Because while getting this information across, I came across a lot of people that actually know Dr. Obieze, and it will be a good opportunity for him to reconnect. So if your path has crossed before, I think it would be nice if you can show your camera so you guys can, while we're getting ready, we can still have something to talk about.
All right. Once again, thank you for the opportunity. My name is Dr. Obieze Nwanzema. Also here is my partner, Albin Madwako. So both of us will be more than willing to answer any questions you have, put more light on the topic we're going to talk about today, which is pathways for foreign doctors in the US. To help the conversation, I thought to start with a little bit of my background. So, like I said, my name is Bieze. You can see I have an MBBS, not an MD, which tells you that I trained outside the US. And it's something I'm very proud of, and I always make a point of putting MBBS rather than MD because I wear it as a badge of honor that I graduated from University of Nigeria, Nsukka. I also have a master's in global health sciences, but in terms of my roles or my positions, some of my current positions are that I am a general surgeon. I trained in Maine Medical Center. I also immediately after started my cardiothoracic surgery fellowship. So right now my focus is on cardiovascular diseases and thoracic diseases. So basically doing a lot of surgeries in the chest. I'm also the founder of a non-profit organization called Joint Medical Lifesavers Foundation, which is a Nigerian-based NGO that provides access to healthcare for vulnerable populations across Nigeria, mainly in the east and the southeast, and also around the middle belt of Nigeria. I also am passionate about communicating my ideas. I'm an author, so I have a book which I might talk about a little bit on this conversation, and it's titled Competitive Edge, and it's geared towards people like you or people who are looking to understand what the pathway is for physicians looking to get into clinical practice in the US. One of my favorite things to do is to be creative, and in the medical space, I am involved in medical innovation. I do have a patent for a couple of medical devices. One is LadyScan. That's a handheld device to detect cervical cancer before it really becomes cancer. So we're talking about pre-cancer. And there are a few other projects that I'm actively involved in currently. What I do exactly. So I did train in general surgery, so that's a 5-year residency training. I did that in Maine, and that training exposed me to open surgery, general surgery, be it in the abdomen and the chest, sometimes head and neck, vascular surgery as well. I also have extensive experience with laparoscopic surgery. So be it laparoscopic appendectomies, gallbladder removals, colon resections, basically minimally invasive surgery. I also have experience with robotic surgery, so performing surgeries using a robot, be it in the chest when we're doing long resections or esophageal surgery, or also in the abdomen when we're fixing like your inguinal hernias or your abdominal wall hernias. These are all things that I am facile with. Specific to cardiothoracic surgery, which is where in the US I will spend the most of my time on my career. The training encompasses open heart surgery. So for people who need coronary artery bypass or CABG, people who have birth defects or congenital heart defects, be it tetralogy of Fallot, VSDs, whatever have you, those are things that we get exposure to. Or people who have heart valve diseases. In Nigeria, will be commonly things like rheumatic heart disease that leads to an abnormally functioning heart valve. Those surgeries are things that are part and parcel of the training, in addition to heart and lung transplants and other general thoracic surgery cases. I just thought to use this opportunity to highlight some of the people who, during my training or the course of my career, have been pretty helpful. The first picture here is me on the left, obviously. On the right is Dr. McGrath. He's a cardiac surgeon who served as a good mentor for me, actually, when I was in my residency training. On the right is me and another surgeon. This is Dr. Carter. He's a trauma surgeon. And we were just finishing a thoracoscopic surgery or minimally invasive surgery in the chest, where we repaired a patient's rib cage. The patient had multiple rib fractures. And a good friend of mine who was a year ahead of me in medical school, Chinedu Okoli, is also pictured here at the bottom. Fortunately, we were able to get him into the same program that I was in, He actually had finished his general surgery training in Nigeria and was he's a general surgeon in Nigeria, and then made the decision that he wanted to relocate to the US. So fortunately enough, we're able to grab him. And the irony of life is he started his residence in the US behind me, even though he was a year ahead of me in medical school, which goes to tell you that there really is no such thing as, I'm starting too late, or I've gone too far to turn back, or I can't leave Nigeria. So how did I get here? It's a long journey. I was joking with someone when I told them that when I started medical school was in 2000. Lots of strikes, lots of things in UNN. We finished 2009. So I graduated med school 2009 from University of Nigeria New Campus, or UNEC. I did my housemanship at Federal Medical Center Owerri, followed up by NYSC in Kogi State. And I worked as a general practitioner. I did work a little bit offshore as a physician for a couple of years, but I always knew I wanted to be a surgeon. There were multiple challenges. There are multiple challenges in Nigeria with respect to getting a residency training opportunity. Sorry, excuse me for a second.
You good? Toby, you good? Hello? Okay. Okay. Try to unmute now.
Hello, can you hear me now?
Yes.
Okay, perfect. I apologize for that. So after that, I did start my nonprofits in Nigeria. Like I was saying, I always knew I wanted to be a surgeon. It was a question of where and when. There were few spots in Nigeria and there still are, for residency, and it was always an issue of, okay, we're going to have this call for residency training, and during that call, it would always seem like whenever they were having it, I'll be abroad or I'll be doing something else. It just was never the right time for me. But also for me, I wanted to train in a place where I would have, one, the best training, two, that I would be able to operate as a surgeon to the fullness of my potential. So a part of me knew that I was going to seek training outside Nigeria at some point. It was just a question of when. So what I did was I decided to do a master's in global health because I was interested in public health after starting my nonprofits. And after that, I worked for a couple of years as a researcher, and then I started my residency in May. While I was working as a general surgeon, that was when I fortunately was opportune to have a rotation in cardiothoracic surgery midway in my residency. And that opportunity was what changed my mind from wanting to be a trauma surgeon to wanting to be a cardiac surgeon. And I think it was the best decision of my life. So enough about me. I think the real question today is, for people in your position or people that you know, what are the options for clinical practice in the US? How can you get to be a clinician or a physician in the US? And it doesn't have to be the pathway that I followed. The pathway that I followed was unique, or is unique to me, because of the things that I wanted for myself in my career. I wanted to start a nonprofit before leaving Nigeria. I wanted to have experience in public health and research. And I did all those things before starting residency. So I would say there are generally three options for you, maybe four actually, options for you if you want to practice medicine as a foreign medical graduate if you want to practice medicine in the US. One, which I did not list here, is you go and do everything all over again, which is you go and start medical school again, or you go to DO school, which is Doctor of Osteopathic Medicine, or you go, to PA school maybe. There's also a pathway of, becoming a nurse, becoming a nurse practitioner, but that's not being a physician, but that's being a clinician. Those are not the things or the focus of this conversation. The focus of this conversation is for people who are looking to still be MDs, so to speak, or to use their MBBS degrees when they are here. There is a traditional pathway, which is what I did, which is you go through a residency training, and that would mean that you have to take the board exams, and then you apply with everyone, and some program has to look at you and say, you're worth taking a risk, we're going to take this person. It's very hard. I'll give you the statistics on the success rates of this, but it can be challenging to get. The next is you can practice in the US under a limited license as a physician. You may or may not need to have a residency training under your belt, or you may or may not even need to have taken the USMLE exam. But your scope of practice will be limited. You have to practice under someone who is fully licensed, and it's only feasible in certain states in the country. So thinking about New York, Florida, Tennessee are the biggest ones. And then you can also have an unrestricted license through that limited license pathway. So when you have somebody who's had a limited license for a few years, they can actually then be grandfathered into having a full unrestricted license if they're in good standing. And I'll talk about these scenarios very clearly. So the first one is what I call the Florida pathway. So basically, the present criteria for unrestricted license is you have to have completed 1 year of residency in Florida. What that means, without spelling it out, is for you to do residency, you have to have taken the USMLE exams. So there's step 1, there's step 2, CK. There used to be CS, it no longer exists, but there's the OET, and there's some other alternative pathways that you can follow to fulfill that clinical requirement. In addition to that, you may or may not have taken the USMLE step 3, but you should have taken those exams and you should be ECFMG certified. Some people are familiar with what that means. If you're not, at the end of the conversation, just let me know. I can explain that specifically, but I'm trying not to go too much into the weeds so that we can actually cover the scope of the topic that we have today. But to summarize this pathway, you should be ECFMG certified, which presupposes that you've taken all your exams, and then you get a residency program to give you a position, and you've completed at least 1 year of residency. This is what the current policy is. But right now there's legislation in the Senate to try and make some modifications or take away all these some of these restrictions. The reason is we don't have enough physicians in the US, period. No matter what people say, no matter how competitive it is to get into residency, we still do not have enough physicians. And we're unlikely to have enough physicians in the next 10 to 20 years. What does that mean? It means that as time goes on, there will be a need to relax some of these laws, and many states have done that. Florida, Tennessee, New York have created these caveats that gives people who are foreigners or have studied abroad the opportunity to practice medicine in some way, shape, or form. This legislation, there is a current legislation being reviewed right now, and the proposal is to waive that residency requirement I described before for individuals who have completed a residency in their own country or some other country other than the US, or they've done some postgraduate medical training. outside the US. So like the friend of mine who I showed in that picture will be somebody who fits into this category. He's done a general surgery residency training abroad. That person should also have a valid medical license in that country and should have practiced medicine for at least the 4 years before they are applying or coming to the US. The other thing is there's a small caveat that it said, okay, maybe you may not have practiced medicine for 4 years, but if you've taught medicine for 3 years before you apply, you should be considered. So this is the current proposal on the floor, and hopefully this will pass and become a new law for Florida. The last part of the requirement is that in addition to all these other things, there has to be a hospital that is willing to hire you. You have to have a job offer. This is where the challenge exists, because for somebody or a hospital to be willing to hire you, there's a lot of risk involved. Malpractice, insurance, there's uncertainty as to what's the level of expertise this person has. Will they practice medicine at the same level as someone who's trained in the US? There are all those questions that exist. So it brings up the point that for this to work for people in your position, either the country you train, the degree of training has to be something that's very familiar to the people in the US, or you have to have people who are like in my position who understand or know for a fact that, okay, I understand the health system, I can evaluate this candidate, and I think this person is worth a shot, right? Those are things that have to be in place. Otherwise, you can see that it will begin to become hard for people like you and me who just come here and nobody knows you. But it is a pathway. In Tennessee, they also have their own criteria for clinical practice for doctors. So that person has to be able to or can bypass residency training if they take the board. There's a board exam that they need to take for the state board. So that's the competency on the state board. But they must have completed at least 3 years of training, or should be in like a residency training or postgraduate training program in their country at the time they apply. The next thing is that for at least the past 3 years before they come, they should have been clinically active. So you should be, practicing medicine or providing care somewhere before you come, because they don't want someone who's rusty or who hasn't practiced for a long period of time. And then you have to have proof, just like in Florida, you have to be able to present proof that Hospital X is willing to hire me. Here's the offer letter. When you have all these things, you can submit them to the medical board, and then they'll consider giving you that temporary license. 2 years after you have a temporary license, which means you're already in the US, you're practicing under supervision, you will be eligible to apply for an unrestricted license. This is new, this is big, because historically, people always have to do the residency pathway, which I won't lie to you is not the easiest pathway, but it's very doable. It is a pathway that guarantees that the residency pathway is one that guarantees that you can be free to do whatever you want, basically. No one has to supervise you. You don't have to worry about any laws. You're not restricted by or bound to a particular state. The New York also has something similar to the prior two. I won't dwell a lot on this, but basically, in their case, they're saying they will allow you practice medicine like in a general hospital, a nursing home, psych, or developmental disorder treatment center, or an alcohol treatment center, or in a non-profit providing care for people who have chronic pain. And in this scenario, you have to be supervised. It's not like you're going to be on your own, like doing things. Like there has to be a fully licensed physician overseeing what you're doing. I think every doctor in Nigeria right now who is practicing without restrictions would have some reservation about someone needing to approve what they do. There is that, you want that freedom to think independently and because that's why you went into medicine, to be a doctor. You want to make up your mind, look at the patient, evaluate them, and say, I think this is what's wrong with them. I think this is what should be done. But sometimes concessions may need to be made. If you think this is something, for you, we can talk about it. The criteria for the New York license is, you should have completed all the criteria for licensure for you, like for ECFMG, but you don't necessarily need to have taken the USMLE exams, all of them. For the foreign medical graduates, they have to be in good standing with ECFMG. So any of the educational requirements that they set forth. So there's some schools that are listed. There's a big list. It's just like the GME's list of, GNC in the UK, where they have a list of schools that are in good standing. Your school has to be one of them. And there are a few other criteria that need to be met that we can talk about, one-on-one if we get the opportunity to talk. And then my favorite, I might be biased, is the residency pathway. And this pathway is one that the majority of people Nigerians who practice medicine in the US have gone through this pathway. But there's a lot of uncertainty, a lot of fear when it comes to this, because people think it's impossible. I'll tell you that, I'm proof that it's not impossible. It's hard, but the fact that it's hard doesn't mean it's impossible. And when you even say it's hard, that's very relative. It depends on what specialty you're going into, what time you're applying, what you look like as an applicant or candidate. But that said, the big questions people have is, what's residency like? What are the materials that I need to study or to prepare for the USMLE exam? What do I need to be able to get into residency? And what are my chances? And how do I improve my chances? And after those questions are answered, most people would want to know, how do I get started? So for residency in the US, I'll say the experience is variable. It depends on your specialty. Your specialty, every specialty has a culture. Sorry about that. Every specialty has a culture, and there's stereotypes. People say the surgery is the most competitive, or one of the most competitive specialties to get into. People say that surgeons are very difficult people to get along with. People say that, and some of the specialties are more friendly to international medical graduates. People say that, and there's some truth to that. But I think everyone's case has to be individualized. There's no one size fits all generalization, and I'll be able to dispel some of those myths in this conversation. But if you're in residency, it's going to be busy. You have about every day is 12 hours of work, and then it's about at least 5 days a week, or 5 to 6 days a week. And there's usually, call and things like that on the weekend or maybe on a weekday. So you're going to average about 12 hours a day of real work. We're not talking about, if you go to work and then you can go chill somewhere and not show up. No, when you're at work, you're really at work. And I speak, for medicine, internal surgery, pediatrics, like it's usually all the same. Surgery may be a little bit more tasking or physically demanding, but there is that. But the one thing you know is that it is better equipped than most places that you've worked, and you have resources, be personnel or equipment, to be able to practice medicine to the fullness of your aspirations. So if you want to give a patient 20 units of blood, because you're operating on the patient's bleeding, there's a very good chance that you would have 20 units of blood. Not every day, but there's a very good chance that one time you will have it. Or if you want to order an EEG for a patient or an MRI, you're pretty sure that that patient can get access to it And that brings a certain degree of joy and closure to how you practice medicine, because I know that when I suspect that a patient has neurocystic psychosis, for example, and I want to order a CT scan, I know that I can order it today, and in 4 hours, that CT scan will be back, and I will confirm my clinical suspicion. I'm not guessing. Or if somebody has a brain bleed, I can get an MRI within 1 hour, and that would be feasible. So those are all things that give you joy, because you're doing the things that you want to do and it's moving. I won't be unable to do a surgery because the patient does not have their echocardiogram results, right? Those are things that take away from your joy or fulfillment of being able to practice. So that for me is how I describe residency. You will meet a lot of people, interact with a lot of people. Your residency will shape how you practice medicine for the rest of your life. I will say that. And for me, it was a great experience. The USMLE process is it's a process that is very, it teaches you a lot about yourself, because this is one exam or series of exams that there won't be any exams like this that you'll ever take in your life. It's very unique. It's a standardized test. Most of us in Nigeria have not taken standardized tests, and it's not particularly difficult. It's just that there's a system to it, and until you key into that or understand that, you might have a hard time, or you might not really understand how you should progress. But in the USMLE process, some of you might be in that process right now. The key tenet I'll give you is try not to study alone. It's just like the NCLEX for the nurses. I would say try not to study alone. Create a group or your team, which would be people who you guys keep each other honest. You guys study together, or even if you don't study together, you have like a WhatsApp group that you can text each other and just keep each other honest and be like, have you studied today? What have you achieved? Okay, I want to share this topic with you. Something that gets you all constantly thinking about the goal and moving forward. So these are the exams I talked about them before, and one-on-one we can delve into full details. The big question most of you will have is, what are my chances of getting in? So I say it depends. And this is not an exhaustive list, but it depends on the specialty you're going into, and I'll show you the stats for them next. Some specialties are easier for foreign graduates to get into than others. It depends on your year of graduation, because people are, I don't know why, but people are sort of selective because they want fresh graduates. They feel like the farther you are away from training, the more you'd have forgotten, the less you'll be able to be a great physician. I don't completely agree with that. But at the time, people have these hard and fast rules that they come up with, and like, oh, you can't be more than 3 years post graduation or 5 years post graduation. And some programs actually have it on their website. They won't consider anybody who's more than 3 years post graduation. I think most times, or how it may have started, is that applies to US graduates, because most US graduates, they apply for residency the 1 year before they graduate from medical school. So they're in final year, but they have like a long period of time when they're applying, maybe 6 months, from the time they interview to the time they match. And then when you think about it, you're applying a year before you're ready to start. So if you miss that chance, okay, fine, you have 1 more year. But if you try 3 times, most people think there's a red flag. Maybe that person is not a good candidate. So that's probably how this started, if I were to guess. But for foreign graduates like us, you can see from my history, you finish medical school, you have to do your housemanship, that's 1 year. NYSC, that's another year. And maybe you have to make some money and understand your bearing and raise funds to come here. That's at least 3 years. So that puts you at a competitive disadvantage. But there are ways to address those things, because at the time I applied, I was 9 years post graduation. It didn't stop me from getting into surgery residence. Your test scores matter, or at least used to matter when there was step one. That step one was not pass and fail. Now, step one is pass fail. I think that would hurt IMGs more than it will hurt American medical graduates. But step two is still graded on a 3-digit score, so you can at least use your step two score to show that you're better than your competitors, so to speak. At least that's one objective way of doing it. But in a sense, I would say the strength of your application in general, be it your personal statements, your US clinical experience, or letters of recommendation, those are things that would strongly enhance your chances of getting in at the time you're applying. Research is helpful. It shows that you are committed to a certain level of academic pursuits, but also it shows your commitment to a field. So if I'm applying to neurology, for example, and I don't have any research in neurology, it's not the end of the world. But if I'm neck to neck with somebody who has 5 publications in neurocognitive diseases or neurology or neurosurgery, people will take that person more serious because they think that person has shown evidence of being committed to that field. There are pros and cons to that. Because if you're trying to apply to multiple specialties and then you're super niched into one, people might ask you, well, why are you applying to obstetrics and gynecology if your research is only in neurology? So those are things to keep in mind. But by and large, any research is better than no research. And in Nigeria, there's a term they call IM. And people think that in America it's not a factor. That's not true. Who you know, the connections you have are extremely important if you have them. When I came to this country, I knew nobody. I think the only person that I knew is my partner who's on this call, actually. But you have to build those connections as we move forward. So connections are extremely important because there are lots of people who are going to be on the same boat as you, and both of you have exactly the same thing on paper. But because of a connection they have to a program, maybe they did a rotation there, or they have a mentor who knows somebody there, they get that extra push and they are the ones who are going to get that spot. So those are things to keep in mind. What are my chances of getting in? Like I said, depends on multiple things, but also depends on your specialty. So here's a list of, on the left, all the common specialties people apply to. And this is in the last year, the probability of success, or sorry, the match rates, not probability, because these are real facts. This happened to people. The match rates for people who got in. So you can see general surgery. So categorical, there's a difference between categorical and prelim. Prelim is like a trial. It's a 1-year period where you only have that 1 year of residency. You're not going to, it's not the full residency. It's some people call it basic. There's another term for it, but it's like you do this for 1 year. After that, goodbye. After that 1 year, you have to reapply. Maybe that hospital accepts you as a categorical. Categorical is the real deal. You're short of your spots for either 3 years, 4 years, 5 years, however long the residency is. And for surgery, you can see that the categorical position, only 10% of foreign medical graduates applied. And we're talking about tens of thousands of people applying every year, right? So I was fortunate when I applied, I got in as a categorical. I did not do a prelim year. So if you're looking to apply and you say, oh, I want to do surgery, the statistics will tell you that if you're going into surgery, you have a higher chance of getting into prelim than categorical. But I will tell you, apply for both. With respect to internal medicine, you can see that the match rate is higher than surgery, 10%, 40%. Pathology is about the same as internal medicine. Family medicine was lower, but people still got in. Pediatrics is lower. You can see it's just in descending order. Apparently, you have very close to 0% chance of getting into dermatology. I am not somebody who believes that things are impossible. I would say that it depends. You might be one person who gets into dermatology, and if the denominator is 10,000 or 1,000 people applying, it would be 0.00001, right? But you can be that person. You can be that one person. So I would say looking at this list, it should inform your decision in terms of how hard you work. But it shouldn't sway you. If you're passionate about being a surgeon, I say go for it. Don't let the statistics dissuade you. I try to address these questions, but these are questions you want to ask. Again, if you want to get into residency in the US, these are questions, if you're just trying to start, these are the questions you need to ask and have it, documented somewhere in your mind or on paper to make an informed decision about moving forward. But if you're having issues, you can always reach out to me. The area that I enjoy working on is looking at a candidate and saying, how do I improve this person's chances of success? Because that's what they want to know. Your competition is stiff. You're competing with people who are applying to the same university where they went to medical school. Their scores are good. They know the lecturers or the faculty. They may have done research. And then you are coming from a country that may not even be known, from a university that's most likely not known, with a letter of recommendation from a lecturer who is absolutely not known. And you want them to pick you over the people they're familiar with. That's the challenge you have. It's not an impossible task, but I need you to keep that in mind and know what you're working against and realize that there are hundreds and thousands of people, foreigners, who are successful. There's a statistic I saw that said up to 80% of the Black physicians in America are Nigerians. Not Black foreigners, Black physicians, of Nigerian descent. That tells you that, there is a space for people like you and people like me. Be you Nigerian, be you from Cameroon, be you from Angola, Ivory Coast, wherever it is you're from. The way to ensure that you are successful is to look at your application or yourself as a candidate, identify your weaknesses, identify your strengths, enhance your strengths, optimize or mitigate your weaknesses. So I usually say to people, you have to find what makes you special. And that's called I call that your competitive edge. You need to find it. And if you can't find it, you need to build it. You also need to optimize your application package. But at the point where you're putting together your application package, I usually tell people the ship has almost sailed, right? You can modify a lot of risk factors that you have early. You can do, if you're applying next year, you can do research now. You can look for US clinical experience. You can find mentors. You can attend seminars or conferences and network. But if you're 1 month to the application, you can't start any research because it's not going to get published in time to show up on your application. So it's a little late then. But there are things you can do when you're at that stage. So I usually like people reaching out to me when they're very early in the stage. There's no such thing as I'm too early. If you think there's a chance you're going to come to the US, just reach out. That's what I would say to people. Just reach out. Because there's a lot you can do to strengthen your chances. And in spite of all I've said, most hospitals want to take the best candidates. And that best candidate might be you. It depends on how you optimize your chances of success. So seek mentorship, seek guidance, look for people who are moving in the same direction as you. If you're thinking of going abroad, you should be hanging around people who are trying to go abroad. That way you maximize your time, you get more information, you get the right resources. I can't overemphasize that enough, but optimize your chances by building a competitive edge. Think about finding mentors or guidance and groups of people who are doing the same thing. With respect to competitive edge, this is actually something that I gradually put together through my own personal experience, but also working with multiple people who have been applying to residency over the past, call it 8 to 10 years. There are 9 dimensions to your competitive edge. And these are things that every reviewer for residency or everybody in the residency panel looks at when they're looking for an applicant. They're looking at how solid is this person academically? How solid is this person clinically? Does this person have interest or experience in research? Does this person have, teaching experience? Because they want to offload some of their work. They don't want to do all the teaching, but if they have a resident who's passionate about teaching and curriculum design, they push all that work to you, and then you take that, and then they are free to do other things they want to do in life. They are always looking for people who have leadership potential, because again, those leaders would take some of the work or stress off of them, but also those people go on, in the future to become very successful ambassadors of that residency training program. Innovation is something that makes every interviewer's eyes open when they see it, because to them it means that you're smarter than average, but also that you can discover something, or come up with a solution that can help their hospital, either in patient care or help them make more money. They want to know what your professional track record is. So are you somebody that has, for the last 10 years, you've given your life to the field of dermatology, and you've done a lot of research, you've done a lot of community outreaches, you're well established, you're on many of the conferences or committees. Those are all things that they see, and they're really impressed when they see you. And the last thing, which we often downplay in Nigeria, in fact, you're probably advised to hide when you're in Nigeria, is your extracurricular activities. It's extracurricular activities are viewed negatively, or at least most people view them negatively in Nigeria, and you're seen as somebody who's unserious if you say, "Oh, I play chess, I play football, I cook." People are like, "This person is not serious." But here in the US, it is viewed very, very favorably. I cannot tell you how many times I've been on an interview panel for residency, and I'm sitting there, and the reason why they want to give somebody a residency spot is because, wow, this guy, when he was 22, was the head of a rock band, music band. And you ask yourself, has this got to do with being a doctor or being a surgeon? But these are things that are important to Americans. It means you're a diverse person. Being in sports means that you're a team player. It just shows some soft skills, basically, is what they believe. So you have to start thinking about those things. So if you used to knit or used to sew clothes before, start thinking about how those things play into your career. Because somebody who sews, or whose mother used to be a tailor and used to help your mother when you were a kid, that all of a sudden becomes the backstory of your personal statement for residency. And I've read many residency applicants documents that start with, I want to be a surgeon because I used to sew with my mother, right? Little things like that are things you should keep in mind. And as you look towards the future, I think the majority of you who are here who want to apply, the soonest, maybe a few of you might be applying this current cycle, or may have applied, I should say, but a significant proportion of you will be applying in the coming cycle, which is a year away. These 9 things are things you want to create as a checklist and start working on to improve your chances or your competitive edge. And it's something that I'm happy to work, with you on. I did write a book about this. The book is available on Amazon. The name is Competitive Edge. You can just search for Competitive Edge and my name, and you can find it easily. Let me know, later on. I will share my details or my contacts if you are unable to access it, or if you want to get a copy, we can figure out a way to get it available to you. The question you want to ask, I guess, at this point is, okay, I've heard all you said. I want to give it a shot. How do I start? I think that you've already taken the first step by showing up today. The things that will help you will be guidance, mentorship, and being part of a support group. But by and large, the people who are successful for me, I would say it's not because they're the smartest, but I would say one thing that they all have in common is perseverance. I worked with somebody who was applying to residency even before I did. And the person applied, and I got in before them. And I worked with this person, and at the time they were applying, it was the final time that I worked with them, it was their 5th time of trying. That is perseverance. And she got in, right? If that person had stopped at the 4th time, they would never have got it. So sometimes you need to persevere. But you also need somebody besides yourself to look at the situation and help you, because Einstein said insanity is doing the same thing the same way and expecting a different result. So there has to be something different about the approach. And then when we work together, help tweak a few things, it's many times we as Africans are trained to be humble and not showcase our strengths. Whereas here in the US, it's the opposite. People may tend to overstate their competency or their skills, while we as Africans or foreigners may understate our accomplishments because we're trained to be humble. And many times that hurts us. So there's a full spectrum of things that you would need to, one, learn, and then two, do in order to be successful. I will summarize by saying it would mean for you to be successful, you need to find a competitive edge using at least those 9 domains that I talked about, those 9 things that I talked about. And those things will help you have a solid application packet. And when you're ready to apply or you're in the application process, there is a separate process, which is, how to communicate or interview when you do get offers for interview. That is a separate or unique set of skills or skill that I find that many of us foreigners are not well equipped with, because how you interview for a job in the US is very unique, especially in medicine. It's very unique. There's some subtle things that I was never told, but I had to find out along my way, along my journey. And as somebody who has helped people prepare for interviews, but also interviewed people for residency as well, I can tell you that many foreign graduates are underprepared or unaware of what it takes to interview for a residency position. But is it doable? Absolutely. I am living proof that it can be done. You just need the right set of tools, and I'm happy to help. So if you have any questions, I'm more than happy to answer them now. These are various ways that you can reach out to me. You can reach out to me, just send me a DM on Facebook, LinkedIn, or Twitter. I think those are the most reliable ways to reach me. I put up a WhatsApp number here that you can use, during the week or weekdays to, send messages. But the more reliable ways would be the 3 above here, Facebook, LinkedIn, Twitter. Additionally, if you want to send me an email, maybe a document you want to send, I have this Gmail account, which is medical residency application support at gmail.com. Feel free to send anything there. I'll read it and return a response as quickly as I can. And I'd like to pause now and then take questions from you. But thank you for listening. Appreciate your time.
Thank you so much, Dr. Obieze. That was very, very well detailed, I would say, lecture. And I believe you touched every area. There is no more area that is left untouched. After your presentation, I was listening keenly, and I noticed, I saw the passion with which you said this. And what struck me most was the fact that you said that you don't believe that there are things that are not possible, so you were able to do some of these things not knowing anyone. And I believe there are people here today who might be in the same shoes, as well. And I believe they would draw inspiration from what you've just did today. So you came in with a partner. I don't know if your partner has a word or two to say before we dive into the questions. The questions are already coming in the comment section, but I'm also able to give you opportunity to ask your questions to us and, using the mic, but you have to let us know that you have a question. So can you say the name of your partner again so I can spotlight him?
Obinna Maduaka.
Okay, let's see. Obinna. Oh, I didn't see him on this call right now.
That's okay. That's
All right.
fine.
Okay.
Might be having technical issues, but that's fine.
Okay, sounds good. So now over to you all. If you have questions, would like to take your questions. If you want to ask them by yourself, I will give you the opportunity to unmute yourself and but you have to just show a sign of or maybe a raise of hand so we know you have a question. All right. But it's a very, very good presentation. So I don't know how you want to do this. Do you want me to read out the question for you, or you want to read it out yourself?
No, I can read it out while we're waiting for people to to ask their questions, and then while we're between these questions, if somebody wants to ask a question, they can interrupt me at any point in time. That's okay.
Yeah. So I have.
So I'll start with the first one.
Yeah, I have a Ebuka that raised hand. So let's do the people that request mic. Can we do them first? Then later on we'll go to the comment section. Is that okay?
Sure, that works well.
All right. So
Ebuka, go ahead.
Ebuka, you just requested the mic now, so I'm giving you opportunity to unmute. Go ahead, Ebuka.
Okay, good evening, everyone. Thank you, Dr. Bieze, for the presentation. It's very informative. Then I want to ask a question. Does position of an author matters in a research publication? Like, is there any preferred position an author should have in a publication? Then secondly, concerning research also, must it be peer reviewed? Like, can case study, case reports, all these maybe clinical audit serve as a position for research publications in filling your maybe CV or ERA CV or so? Yeah, that's my question.
Okay, let me give you. I think you're muted, sir. Go ahead.
Okay. Great question. So just to expand on your question, the first thing is in authorship, there are two positions that I consider matter the most. One is the first author position, and then the last author. By convention, the last author position is left for the person who's a senior author. So that's usually your professor or the highest ranking person, the person who supervises that whole project. And the first author position is the position for the person who does the grunt of the work, the person who does all the laboring. So in your position, you're probably struggling to get the first author position. That's what you want. So first author position matters the most, or is ranked as the highest. But any position is better than no position. Keep that in mind. So many times you might not be able to be the first author. That's okay. Just be on that research paper, because at some point it becomes a numbers game. And when we talk, one-on-one, I can tell you about different strategies about how to present, your list of accomplishments. Because if you have 5 papers, and if I have 5 papers, and I am first author for 2 of them, and I'm lost in the middle for 3 of them, I want to put the ones that I'm first author as the first 2, and then the other ones list them underneath, because that is putting your best foot forward. You understand? So there are little things like that when it comes to actually preparing your CV on ERAS or on the application software, and that you might need guidance. But short answer, your position has importance. If you have any control over it, you want to be the first author.
Okay, sounds good. Thank you very much. I believe your question was well answered. If that is the case, we will just go over to the next person that has a question at Albert. Albert, I've given you the mic. Albert, you can unmute yourself. Okay, so what? Okay,
Hello.
go ahead. Yes.
Hello.
Yes, Albert.
Yes, please.
Yeah, we can hear you.
All right, sir. Thank you very much for the wonderful presentation done today. I would
If
like
you can
to,
tell us a little bit about yourself, so at least I know how to tailor my answers. That might give me context too.
Exactly. At least we need a location, because I know some people from Ghana, Kenyans are here. So we want to know like your location too.
I'm from Ghana.
Ghana, okay.
Okay.
I'm from Ghana.
And what are you interested
Yes,
in? What specialty are you interested in? You can just say that if you have any.
I'm a mental health professional, and I was looking if there is an opportunity for us also in this particular process.
Okay. And when you say mental health professional, are you in the nursing field, or are you more in psychology, or are you more like physician pathway? Because there are different resources, or I can tailor my advice to you.
It's in the nursing field, sir.
Okay. So I would say the sky is the limit. For a nurse who is interested in mental health, there is a huge mental health need in the US. And you will not have enough doctors to fill that need. So the pathways exist for you to become a nurse practitioner, and you can focus on psychiatry or mental health as your niche. I work with these people because we tend to call them for our patients in the hospital. You can work in the hospital, or you can work like in the office as like outpatient services. You can be part of therapy. There are multiple options for you. So the short answer is yes, there are.
Thank you very much, sir.
All right, Albert, and to add to that, there's going to be another seminar like this for nurses. So I'll be sending out the publication soon. I think we'll be reaching out to you through the email, so you would get our publication and the link, so we can come and talk more about pathways for nurses, okay? All right, so I have Kachi. Kachi, I'm going to give you the mic now so you can ask your question. Go ahead, Kachi.
Okay, thank you so much for your wonderful presentation. I hope you can hear me. Thank you for
Yes.
a wonderful presentation.
Yes, Kachi, go ahead.
I have a couple of questions, please. I ask for your indulgence. First, I'm a senior medical officer. I work in Federal Medical Center, Jabi. Of course, the census should know the place. And I've worked there for like 10 years, and I'm like 14 to 15 years post-graduation. So now the thing is this, I'm scared. I don't know. Do we even stand the chance for someone that is like 14 years post-graduation? I've been working, I was in the general surgery. I'm a general practitioner anyways. It's not like I have primaries, but I'm just asking, what are my chances if I'm to try USMLE? Because I've heard something about, even before you said this, that the year of graduation has already disqualified someone. So I'm now trying to ask, those other pathways you mentioned, the restricted license and all those things, I mean, how does one come in? How does one fit in? Or do I still stand a chance using the residency pathway? I hope my questions are not too much. Thank you.
No. Your questions are very valid. So I am not in, it's a very hard thing for me many times because my personality is very different from other people. And I try to give people the advice that is for them, not what I would do. But many times I also try and tell people what I would do. And I'm very clear about this is me and what I would do. My type of person, I don't think that anything is impossible. I think the most important question for me usually will be, do I want this thing? And if the answer is yes, then I'm going for that thing. I'm not advising you to take that approach, but I'm telling you that's the approach that I go through. But the good thing is that you have options. You have the traditional residency pathway and you have the alternative pathways. What these two things are telling me, or the fact that you're considering these two things, it tells me one thing: you're considering migrating from the country. And there's a question of in what way, shape, or fashion. I would say limited license is an option, unrestricted practice or residency pathway is an option, teaching is an option, working as a researcher is an option, transitioning from clinical to something like pharmacovigilance is also an option as well. There are different pathways for a physician to any leading in the US in the healthcare space. And I think I'll be talking about the non-physician pathways maybe in a few months from now. But bear those things in mind. Now, to answer your specific question, if you were not afraid, I would say there's something wrong with you, because it's a normal human feel. To be anxious or to be worried about it, it means that you're thinking about things critically. My issue is usually don't let your fear rule your decision. So somebody like me would go for it. I would ask myself, even where I'm at, what are the things that would help me secure a position? You've got to nail your competitive edge. You have to look at that list and make a longer term plan than an average person. Somebody who's just coming out of medical school may make a 1-year plan because you're not going to say, oh, your year of graduation is long. But for somebody in your position, you might want to make a longer plan, say 2 years. And in these 2 years, I'm going to create a persona, a profile, that showcases the areas that I'm interested in. Let's say you're interested in getting into internal medicine, and you're looking at doing a fellowship in gastroenterology. I want to get as much gastroenterology experience under my belt now as possible. I want to have research publications that would show my interest in gastroenterology. I want to find the gastroenterology conferences in Nigeria and also those in the US and see the ones that I can submit papers to so that I can show my presence. I want to start looking at hospitals where I could potentially get into internal medicine and start making contact with those people or finding a mentor. It could be a Nigerian mentor, it could be a non-Nigerian mentor, because I know you're in Jabi right now. So those are all things that you can do while you're living your normal life right now. And all that will happen is you're still doing what you're doing, but you're building your competitive edge. Remember that the probability of you getting it if you don't try is 0. The probability of you getting it if you try is not 0. It might be close to 0, but it's not 0. And you would never know until you try. So somebody like me, I will always try my luck because I only have one life. And I want to live that life to the fullest of my potential. So this is something that will require a lot of conversation, and you can feel free to use any of the contact information here to reach out to me so we can talk a bit more one-on-one. But I would say I usually tell people I'm less worried about your year of graduation or your fear that you won't get in. It's just I'd have to see what your application is. I have to see what your background is, and then we'll talk about creating like your competitive edge. It is your competitive edge that gets you a spot. It's not just one thing. It's not your year of graduation. People can turn a blind eye to your year of graduation if they look at it as this guy has 15 years of independent practice as a physician. And that's usually how I frame or encourage people to frame their application, because that's really what it is. You practice medicine for 15 years. You should be at an advantage, not a disadvantage, compared to somebody who has never practiced medicine for a day in their life. Their only competitive edge is that they are just coming out of a US system. I hope that answers your question. And
Yes.
for any follow-up you have, you can reach out to me and we'll chat more. Okay.
Thank you so much. Thank you. I appreciate that.
Thank you, Kachi. Yes, I know you and I know you can do this. So just get on it and then let's see you in the US in a couple of years. All right.
Yeah, thank you. Thank you. I appreciate that.
Okay, so
And when you're talking, just don't forget, just tell me your name, tell me, where you went to, the name of your school, what you're interested in, or what you're doing right now. So at least I can tailor my answers to help you best.
okay. So we have Ebube. Ebube, I'm going to give you the mic now so you can unmute now and ask your question. Ebube, are you there? Okay, while she's getting ready, we can take question from Wole.
Hello, good day.
Oh, okay.
Good day.
Okay.
Okay, thank you so much, Decency, for giving me the opportunity to speak. And I want to really thank you so much for organizing this platform. I'm really very grateful. I got this invite through like two of my nurses in my hospital, and I'm really excited to be here. Thank you so much, Decency.
You're welcome.
Dr. Obieze, it's always nice and soothing to hear from you. I am Ebube. I'm Dr. Ebube. I've interacted with you on a personal note in the past. You've always remained an inspiration to us. I'm actually a surgeon. I'm training back here in Nigeria. I'm in plastic surgery residency. In short, I'm in my penultimate year. Practically, I'm done. I'm just waiting for I'm at the level of my dissertation. So once I can get my dissertation sorted out, I think I should be appearing for the exit exam. That's the fellowship exam. So I've always looked up to you, Dr. Obieze, as a source of inspiration. Well, I was like 6 sets below in medical school. I finished from your University of Nigeria as well. I finished in 2013. Yeah, so I'm like 10 years post graduation this year. Well, you and as well as Dr. Kogi have always, and other seniors that have gone ahead of us in US have always been a source of inspiration. I've always wanted this, but somehow I've gotten this residency here and things really derailed me. Let me get quickly straight to the question to save time. Does local research here in Nigeria, does it really help in the mainstream of things when applying? Now, for we that are here, how do one go about getting US clinical experience? Is it possible to apply from here in Nigeria and you can be able to get some US clinical experience, research experience? The local, that's second one. The third one is do local seminars, like conferences, like like I told you, I'm a plastic surgeon, and yearly we attend these plastic surgery conferences where people get to present, and the same is applicable in every other specialty. So do local seminars attendance, does it help in one's application? And eventually, if one gets opportunity to attend some international seminars, like I've tried to attend some international seminars, though some of them is tied to you assessing, because most of the times you want to assess some sponsorship, but the sponsorship is tied towards if your paper is accepted. So if your paper is accepted, they can agree to sponsor it. So sometimes I'm usually unlucky in that aspect. But the international seminars matter. Then fourthly, volunteering. Like back then in school, we do a lot of local volunteering, going to villages, going to IDP camps and administering some form of medical care to them. Do these things really matter? Then finally, now, is it possible to switch like just as you said, someone or his CV is tailored to a particular aspect, like a personal example. Like I don't know, I'm seeing probably the chances of I begin to doubt the chances of like someone like me getting into a plastic surgery residency is quite glim. So I was thinking, is it possible once to start considering things like general surgery? Is it better over there? So, but if one CV has been tailored to, oh, you have all your life you have been doing for the past 8 years, you have been in plastic surgery, and all of a sudden you're now applying to a general surgery program. Do you still stand any chance? So these are my questions. Thank you, Dr. Obieze, for your time and being with us here. Thank you so much.
Anyway, thank you so much for your kind words. I really appreciate it. I think the reason I do what I do is for people like you, because very often like when I came to the US, you get into situations where you see there are lots of Nigerians here, but there are very few people who really want to help. There are very few people who care enough to look back and then reach, extend an arm out to help pull people up. So it's people like you that are the reason why I do what I do. To answer your question, so one short answer for everything you've asked me, the answer is yes. Does local research count? Absolutely. It counts for sure. There are some places, yes, there's like an international ranking system for journals. And, if you publish in a journal like Nature, it's a high impact journal. But not everybody gets to publish in Nature. Plus, you're a foreign grad, no one is expecting you to publish in Nature. But as a trainee, I find the majority of people that are reviewing, they're just looking, do you have any research or not? If you do, what is the topic? They don't really care that it is, especially for a foreign grad, that it is in Journal of Surgical Research or Science or Nature. They really don't care. So all your local work counts. It's very important. And for me, when I came to the US, I did a master's, and when I was applying for the master's, I had 2 research ventures. I did them in my housemanship at FNCOA. And I attended conferences and presented abstracts. Those things were in my CV, and those things played a role. I'm pretty sure they played a role in my application. Those same publications or abstracts, because I didn't even make them a full paper, are still in my resume and have still been a part of my resume for residency and also for fellowship. So those things are very important. Attendance at a conference does not count for anything. Presenting at a conference counts. So at all those conferences, if you give a talk, it has to be on your application. It has to be on your CV. If you submitted something to a journal and it's under review, it has not even been accepted, but you submitted, there is a spot for you to put it in your application. So trying to publish something is always good. Books, if you've written like a book chapter, at first it's related to medicine, yes, that counts as well. Your chances of getting research opportunities in the US, I think you asked that question. You do have a chance. There are research fellowships. Most research fellowships are like a job. You're going to work as a researcher. But the thing about them is that they would presuppose that you have a certain set of skills. So you should be able to like design a study or analyze the data, or you have some statistics background. So that's something that, if you have a statistics background, you can argue and you can apply. Yes. The problem is, or a problem is, as somebody who's not physically in the US, the question will be, are you going to be doing that fellowship remotely, or are you going to need a visa to come to the US? So those are considerations to be made. And I'm happy to give you more insights, like one-on-one, about how to navigate those things, because I was a research fellow I did a research fellowship for 2 years after my master's before my residency, so I'm very familiar with that space. And I can point you to in the right direction with regards to which universities or which websites to follow. I can give you all that information. So that's the question about research fellowships. I know you're in plastics and you're worried about your chances of getting to plastics. So the top 3 surgical specialties or fellowships that are the most competitive in recent times have been a rotation between cardiac surgery, plastics, and pediatric surgery. The last 2 years, or 3 years, cardiac surgery has been the most competitive. Before then, it was plastics, and before then, it was pediatrics. But the way it's done here, general surgery, like most people do general surgery first, and then they go do a plastic surgery fellowship. There are some direct plastic surgery residencies. There are not many, but you have more general surgery first and then plastic surgery later. So it will not be a surprise or out of this world if you say you want to apply to general surgery in the US. No one will look at you funny at all. In fact, if you said you wanted to apply to internal medicine, nobody will still look at you funny because lots of people quit surgery, even in America. They finish surgery, they're like, this is a horrible lifestyle. I want to focus on my family, or this is too much work. I don't want to do this. And then they go do internal medicine, pediatrics, or family medicine. So you can apply to, I think it's reasonable for you to apply to general surgery. It's very reasonable if you want to consider internal medicine, family medicine, emergency medicine, pediatrics. Those are all reasonable things if you want to pivot. But I'm saying this as a general thing. I usually prefer giving people, like sitting down one-on-one with somebody to say, okay, fine, where exactly is your head at? And I'm sure that I can give you the right advice that would help you. But short answer for all the things you asked, the answer is yes, 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 yes. You can definitely do all these things. And 10 years post-graduation is not a big deal. I was 9 years post-graduation when I applied, or when I finally matched.
All right. Thank you so much, Dr. Obieze. And we have 2 more questions in the house. We have Wole. Wole, I've given you the mic now. You can ask your question. And then after that, Joy, get ready for your question. And then we'll dive into the comment section.
Thank you. Thank you very much. Thank you, Dr. Obieze. I'm Dr. Wole Ayebisi. I'm a consultant gynecologist at Obafemi Awolowo University Teaching Hospital. I'm also a laparoscopic surgeon. I practice this every week. But my question is that I am planning to join my wife as a dependent, who is a nurse, very soon. And I also lecture students. So even though I've given it a difficult thought, would you advise that I go through the USMLE pathway, or I should do the Tennessee and the Florida opportunities?
So the most important thing for any individual is happiness. I would want you to do what makes you happy and fulfilled. It can be very difficult to be in the US and your partner is living their dream, and then you are not doing what you're not living to the fullness of your potential. I keep saying that about myself, like that's why I'm here, that's what I enjoy doing, operating and doing things to the fullness of my potential. I would not underestimate, and I'm not speaking about you in particular. I don't know the dynamics of your relationship, but do not underestimate the tension that can arise or the dissatisfaction that can arise if one partner is living their life and the other one is not. I will say, if you are thinking of quitting medicine or you're ambivalent about medicine, like, yeah, I can do medicine or I can do something else and I'll be happy, then there really isn't a big issue at all. There isn't an issue at all in the first place. Because you can come here and then you can do a number of things. You can do research, you can teach, actually. You can do a health science course, pharmacovigilance, clinical research, all those things you can do, and still be happy. That's one angle. The second angle is, well, you want to be clinically active. Then I would say for somebody like you who is actually doing laparoscopic surgery, which is not a common procedure in Nigeria, I would say you're somebody who, I would guess that you're somebody who's hardworking, a go-getter, and has aspired to acquire training beyond what the average person has. So if you permit me to make extrapolations from that, my guess will be that you would want to continue using those skills and you will not want to lose those skills. Am I right or wrong? Okay. So, all right. So I will say, if I was in that position, and I'm telling you what I would do, not necessarily what you should do, I would start creating a plan that will have multiple options. Best case scenario on one hand, worst case scenario on the other hand. Best case scenario being, can I get into a residency program? In which case I'm going to practice medicine unrestricted. And in that residency, best case scenario is OBGYN, which is what you've been doing. But I also have backup plans. Family medicine being number 2 backup plan. The reason is family medicine here has, in my view, 4 main domains. There are people that they just do family medicine, which is like being a general practitioner. But there are some people that have like a niche in it. So the niches are OBGYN and women's health. Just doing basic medicine, pediatrics, and there's also a surgical niche. So doing family medicine, which is more ING friendly, and now having a niche in OBGYN is something that could also serve you better. The only caveat is that often the family physicians who are doing OBGYN may be restricted to work in more rural areas or more underserved areas, which the definition of rural in America is very, 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 there are big cities that are called rural. Okay. So that is one, like looking at the best case scenario, plan A, plan B. And then outside the residency, you can also consider the limited license physician practice, right? Most of those things are newer than the traditional residency. And nobody knows how it's going to go, but it's a policy and it's a law. So there's an opportunity there.
But I will be restricted to those states, isn't it?
You will be restricted to those states. Yeah, you will be restricted to those states. Now, I'll give you an example. There is a very well-respected cardiac surgeon who's a Nigerian. This person did medical school in Nigeria, but went to the UK to do his residency in cardiothoracic surgery in the 80s or 70s. And then he transitioned from there to America. He did one of these similar pathways in, I guess, because there is no record of him doing a residency training in the US. Now, for some specialties, if you train in certain countries, the US will give you a pass that you don't have to do a residency. Orthopedics is one of them, cardiothoracic surgery is one of them. And I've met at least 2 cardiac surgeons who didn't do a residency here. They may have done a fellowship here or not. So there is that opportunity to get in there. And he has been in this institution, it's a big name institution, Mount Sinai. And he is the vice chairman of cardiac surgery. So this is like one of the biggest institutions for cardiac surgery in New York. It's slightly different, because he's done really well, but it's an opportunity. And being in that position, I don't see him, like, there's no reason for him to want to leave or move, right? He's doing well in a very big city. It's not rural. This is not rural. So that's an option. So what I would say to you is, your family has an opportunity to get a better life. Your options are, you can move and be domiciled in the US and follow any of these pathways. You can part-time it, especially when you're trying to get your feet, on the ground. Spend some time here in Nigeria, and then spend some time in the US. while building your competitive edge. But the most important thing is to work as a family unit and realize that happiness is the most important thing. You know, everybody has to do something that they will be comfortable with. And it may require some concessions, or it may be a complete win on both sides. If you are going to do the USMLE route, you know, I would encourage you. I'm happy to be a resource. Remember that it's not a guarantee that you'll get in, but it's a risk worth taking, because if you don't do it, your probability of getting it is 0. Right. So somebody like me, I will try it. Right. You will need a whole plan, like it's a plan A, plan B, plan C, plan C. Like that's how I operate. So that at the end of the day, worst case scenario, you will be successful and you will be happy. Right? Because it's a plan that you created and you will be comfortable with. You will get something that you will be comfortable with. I can guarantee you that. But it doesn't come without planning. So feel free to reach out to me. I'm thinking I might end up creating like a WhatsApp group where we can
Yeah,
just
you know what?
talk.
I think after this meeting, because we're gonna have like 4 more subsequent seminars, and then with the question that Wole asked, I was just, my mind was just racing, and I remembered somebody who had exactly the same scenario. The husband is a medical doctor, a consultant doing very well in Nigeria, and they both relocated here. Wife is a registered nurse. They came in.
It has been a difficult burden for me.
I know. So
I'm just fine there, really.
Yeah, just hold on there. We're gonna have hang in there. We're gonna have somebody like I will invite him and have him talk again on this kind of situation. I will see if he can make it to this meeting and then just talk to us about his experience, and so you can just see like real life situation, somebody who is going the route that you're going. But everything that Dr. Obieze told you is full disclosure. He didn't
Yes.
sugarcoat anything. He just told you the way that it works here, But also hearing from somebody who has a first-hand experience with it on that same route, I think it would encourage you the more. So we'll bring him to this meeting. If it doesn't work in January, it will be in February, but we'll be communicating. So I'm going to try and open a WhatsApp group. And then if Dr. Bieze doesn't mind, I will add him there so he can be like a resource. So if there's any question that pops up and, he's free and chanced, he can drop a comment or an answer to it. So I think that would be nice. And then subsequent programs that we're going to have with Dr. Bieze, we will just have a group where we can just drop the link and everybody gets it. And not other than sending people to send to their friends, and people that are here might not actually get it. So I'm going to send a number to this to the comment section, so you can chat up that number if you want to be added to the WhatsApp group. Okay.
Thank you.
All right.
Thank you, thank you, Dr. Bieze. Thank you.
No worries. Wole, I have a very good friend whose wife came to the US as a nurse. He's a physician. When I was working offshore, he was the guy who actually onboarded me, in the process. Very nice guy. Years ahead of me. And then I kept, from the moment I got to the US, I told him, you need to find your way to get here. Even when I was leaving, but he had ties, he had things to do in Nigeria, but it became apparent at some point that his family would be better served moving, and his wife got a job here as a nurse. And then he came over here, and we talked about alternative pathways, and he opted for the pharmacovigilance pathway. So did a training in pharmacovigilance, has a job, is happy right now. The wife is doing her thing, he's doing his thing. He has peace of mind. It's about picking an option that gives you peace of mind.
I don't know yet. If I drop clinical practice, I don't know how my life will look like really yet. But
for you, I know you will have a hard time with it. Like again, once you told me you do laparoscopic surgery, and I understand how much work you would have done to get those skills in Nigeria. It's not a passive thing. It's not part of your residency training. So I understand the kind of person you are and where you're going. So we'll figure it out for you.
Thank you.
All right. So we had one person that wanted Joy. Joy, do you still have your question, or did we by chance answer your question while we were trying to answer Dr. Wole's question? Are you still there, Joy? I'm trying to see if she's here so I can give her the mic. All right, so I can't find her. Maybe she got disconnected. So, but we have a couple of questions, Dr. Obieze, on the comment section. So if you don't mind, if you can scroll up, or if you want to start from the last one, just to give us like a little bit of information on those questions, please. Thank you.
Sure. The first question is from Ibube, and I think I touched on this. How does one get research positions in the US from Nigeria? There are multiple pathways to do it. It's not, there isn't just one website you go to. And I would say, my advice, I usually tailor it to the individual. Like it's not fair to just be like, oh, go to that website and then, you'll find it, or just go to Google. With the people I work with, I tend to try and understand who you are, where you're going, so I can give you the tools that will help you get to that destination. Because it will probably hurt you if you're interested in getting into surgery, and I go get you connected to some HIV research group. That's like far away from where you're going. That's not the same direction. There are some resources that are specific to surgery.